Could you also comment on the possibility of a double mutant variant, or has there been any uh, role played by the variants? Every virus has to mutate. That is the way that's the way it is supposed to be. But can you comment on whether or not the mutation, the double mutant variant, or other kinds of mutations have resulted in the second wave being more deadly, more infective, or is it just that it's more visible right
Okay, so Timothy, the good news is this is a visible pandemic, at least the second wave. And I call this the visible one and the previous one the invisible one. But either way, people are getting immune. Now, the two good things that we have noticed so far, and I'll start with the good part. People who've been infected are extremely unlikely to have a severe infection second time around. That's something that seems to be across the board, and not just with the original Wuhan virus. We are talking about the B117, which ravaged the UK. The Siren study, which was among the healthcare workers of the UK, showed that while the risk of infection was about 20% in the naive people who haven't been infected previously, it was less than 3% in those who had an infection previously. And that's something that's been consistent across studies. You have an infection once, if you had symptoms and you've had an RT-PCR positive, or you have serological evidence of having been infected, the risk of you having severe disease is extremely small, right? It's as small as for the vaccine or even smaller. And it's probably going to last as long or longer than what you would see with vaccines. And this is a controversial statement, but I'm making this nonetheless, because not all viruses behave the same way. But in this case, the evidence so far suggests reinfections are rare. We have had repeat PCR positives, but when you look at the actual reinfections, and there are groups across India which are looking for this, there are a handful of cases which are true reinfections with the second infection having had severe disease. Okay, so that itself is about the disease. Can a person get infected a second time? Yes, but again, data that came out yesterday or day before in the UK again suggests that once you've had an infection, there's at least 50% reduction in the chance that you will even get infected a second time or pass that infection across to others. So those are two good things. Now, coming back to your question, what is the role of the mutants? Mutations happen, like you said. All viruses will mutate. Every time it infects a person, there is an opportunity for mutation. Fortunately for us, we haven't seen a virus that causes more severe disease. What we have seen is a virus that is more catchy, that is more infectious. So whether you're talking about the double mutant, which I hate to use the term double mutant, because there are actually many, many more mutations within that. But let's call it that because that's what it's commonly known. It's called the B1.617. And then there's one called B1.618, which is more concerning, which is in West Bengal area. But let's think about the one we know more about. So this is one that's been emerging. It's clearly driven some of the pandemic in the Maharashtra area, the B617 variant. And in West Bengal, what we're seeing is the 618 is becoming dominant. And in Delhi and Punjab, we're seeing the 117, which is the UK origin one, which is also seen in Kerala, for instance, and in the south. So all of these variants are more catchy, but not necessarily more dangerous, as in, given that I get an infection, I have a higher fatality or a chance to get hospitalized. So that's the good part. Now, because it's more catchy, areas that would earlier not have normally got infected probably are getting infected faster. And the second thing that's happening is infections are happening much faster, which means the growth rate of this infection is so high that all of these people are getting infected so close to each other and landing up at hospitals, queuing up without places to get in and get admitted. So it's not that, so the infection fatality is a measure of what we think is what we call virulence, or the severity of disease. That seems unchanged so far. Now, whether that will change with newer variants is unknown. We hope and pray that that won't happen. But this increased catchings, if it is not associated with more disease, tells us the time of tribulation is short. We get through this and then we get to herd immunity faster, right? So there are positives to take out of it, but there's immense pain here, and I don't want to sound flippant when I say that this is not too bad. The very fact that it's more catchy is making this whole problem more acute. But at least it's not going to be dragged out for a very long time, which is why I said we will be past the peak in 3 weeks or 4 weeks, at least in most of the areas that are seeing huge numbers of cases. Unfortunately for us in Vellore or in some parts of Tamil Nadu, it's going to take longer because it's not as catchy. It's not getting there. So double mutant, the triple mutant, yes, they seem to be infecting more people. And they seem to be infecting people quickly, but it's not causing more death.